Renal questions 2. 6. The client with renal cancer is being treated preoperatively with radiation therapy. The nurse determines that the client has an undergoing of proper care of the skin over the treatment field if the client states 2. 1. Avoid skin exposure to direct sunlight and chlorinated water. 2. Use lanolin based cream on the affected skin daily. 3. Remove the linens and link marks using gentle soap after each treatment. 4. Use the hottest water possible to wash the treatment site twice daily. The correct answer is 1. Avoid skin exposure to direct sunlight and chlorinated water. 7. Epiotine alpha is prescribed for a client diagnosed with chronic renal failure. The client asks the nurse about the purpose of the medication. The most appropriate response would be which of the following? Epiotine alpha is used to lower your blood pressure. 2. Epiotine alpha is used to treat anemia. 3. Epiotine alpha will help to increase the potassium level in your body. 4. Epiotine alpha is an anticonvulsant medication given to all clients after dialysis to prevent seizure activity. The correct answer is 2. Epiotine alpha is used to treat anemia. 8. The nurse is urging the client to cough and deep breathe after nephrectomy. The client tells the nurse that it is easy for you to say. You don't have this. The nurse interprets that the client's statement is most likely as a result of 1. A stress response to the ordeal of surgery. 2. A latent fear of needing dialysis if the surgery is unsuccessful. 3. Effects of circulating metabolites that have not been excreted by the remaining kidney. 4. Pain that is intensified because the location of the incision is near the diaphragm. The correct answer is 4. Pain that is intensified because the location of the incision is near the diaphragm. 9. The client has been diagnosed with polycystic kidney disease. The nurse assesses the client for which manifestation that is most common for this disorder. 1. Headache. 2. Complaints of low pelvic pain. 3. Hypertension. 4. Flank pain and hematuria. The correct answer is 4. Flank pain and hematuria. 10. The client is being evaluated as a potential kidney donor for a family members. The client asks the nurse why they are separated team evaluating the donor and recipient. In formulating a response, the nurse understands that this being done to 1. Save the client and recipient valuable preoperative time. To avoid a conflict of interest by the team evaluating the recipient and donor. 3. Help reduce the cost of the preoperative workup. 4. Have a sufficient number of persons reviewing the case so that no information is overlooked. The correct answer is 2. Avoid conflict of interest by the team evaluating of the recipient and donor. 11. A client with urolithiasis is scheduled for extracorporeal shock wave lithotripsy. The ambulatory care nurse tells the client that which of the following will be necessary before performing the procedure. 1. Clear liquids only one day of the procedure. 2. A signed informed consent form. 3. Incision of a Foley catheter. 4. Administration of antihypertensive medication. The correct answer is 2. A signed informed consent form. 12. The home care nurse is preparing to visit a client who had renal transplant. The nurse develops plan of care includes monitoring the client of signs of acute graft rejection. The nurse documents in the plan to assess the client for which signs of acute graft rejection. 1. Hypertension, graft tenderness and hypothermia. 2. Hypertension, polyuria and thirst. 3. Fever, hypertension and polyuria. 4. Fever, hypertension and graft tenderness. The correct answer is 4. Fever, hypertension and graft tenderness.